Cases are surging in Kansas and Missouri. Now area hospitals are filling up. There are about 96 ICU beds left in all of the metro and only 16 left in Kansas City proper. Local health experts say things will only get worse over the next couple of weeks, likely. We thank you for joining us this afternoon. I'm Carolyn Long. As these hospitals fill up, they're now having to make some changes. Today, the University of Kansas Health System said it is postponing some surgeries to make room for COVID patients. KCTV5 stands for you, and our Abby Dodge explains how doctors are making those tough decisions.
Doctors say something needs to change. COVID-19 cases are on the rise each week here in the metro. Doctors say this isn't a position they wanted to be in, but people who had surgeries on the books are being told they have to keep waiting.
This is still a significant crisis for us, and it's crowding things, and it's crowding things like elective surgeries, or not elective, but those cases that are going to be admitted, because we've started deferring some of those patients and having to reschedule them to a later date so we could create enough beds for all the COVID patients.
Just last week, Dr. Steve Stites said this step isn't ideal.
The next thing we're doing is trying to think about is who we could try to delay surgery on. We don't want to do that because that is not a good option.
The number of cases continue to push hospitals to their limits. Currently, the KU Health System has 67 acute patients, 26 in recovery and 20 in the ICU. 12 are on ventilators. So far this month, Truman Medical Center is caring for an average of 29 patients each day. St. Luke's says today it has 149 cases. That's up 34 cases from this time last week. Both Truman and St. Luke's say they're not canceling surgeries right now. Delaying medical care isn't something the doctors with KU Health System take lightly.
We worked with our departmental chairs in each of the surgical departments. We asked them to pick 1 to 2 patients who they could try to defer that they didn't think would adversely affect that person's long-term health.
Doctors are trying to reschedule those surgeries within the next 2 weeks. Dr. Seitz says it all depends on the COVID-19 numbers in the coming days. In Kansas City, Abby Dodge, KCTV5 News.